Hi, welcome to TRU Community Care. This is our care center, so please follow me around. My name's Justin. I'm going to give you a tour. So one of the nice things that we kind of talk about being very different from a hospital is that we do have a family room, which is nice for families to kind of step away, get a moment for themselves. We've got kind of those comforts of home, a nice table for them to be able to sit at. We also have a very nice kitchen in here for coffee and things like that. And we use this room a lot just for patients, family members to kind of get away and have a private room for themselves and maybe conversations they need to do. Secondly, we have another family room. We actually use this quite a bit if we have any kids that are visiting, which is very nice. This room actually comes equipped with a TV and a DVD player. So that way this is another family room that we can use. And with the use of this, it allows just families to come in here and relax, take a moment off. Or sometimes if the family wants to stay the night and they end up coming in here just to kind of get a break from the room and watch TV and things like that. So we use this room for that and also just for a place to relax. So as you see, we are TRU Hospice Care. We're a complete kind of separate area from the rest of the hospital. So if you want to follow, we'll go on in. All right, so welcome to TRU. This is the main care center. We are a 7-bed inpatient facility. So as you see, we're kind of set up like a normal traditional type of nursing floor, although very different. One of the things I like to point out is our nurses station. The nurses station is very close to other rooms. And so that way we can have direct visual eyes on patients, on families, things like that to provide that care. Especially if any of these patients are a little bit higher of acuity and need kind of that constant care. So, if you want to follow me back, I'll give you a tour of one of the rooms. So this is our room 4105 here at our care center. You're welcome to come in. So as you see, it's kind of a basic room. We've got a bed for the patient. We've got some seating for family members and or the patient to get up and kind of sit in a different position. We've got a lot of the same things that you would see in a hospital, but these rooms are private, which is great. The rooms actually have a lot of lighting that we can change and kind of set the mood, set the feel, kind of dim the lights for comfort. And they're all accessible by push button for the nurses to come in if there's ever any needs that the patient may have. So the rooms are very nice, they're private and very comfortable for our patients. We can easily make medication adjustments if we need for our patients. So I kind of want to show you the relationship of our patient rooms over to our medication room. This is where our nurses are able to do any medication adjustments that need to happen or get their medications. One thing that's very nice is that our medication room is very full, very well stocked with different types of medications that we may need, so we can instantly kind of make those changes that are going to benefit our patients' comfort. So as I said, we kind of have one side of the hall, which is nice. The other side of the hall is vacant, so we don't have, again, those hustling beds running up and down the hall, and things like that. It actually is a very quiet environment. So one of the nice things too is further back in our care center, we've got different spots that are kind of little places for family members to sit and enjoy, sit and relax, sit and make phone calls if needed. So this is one of them, but if you notice as well, we have a second one over here. Along with this, there's a cart of magazines and books that family members or patients can use. And we also have like a CD player with different selections of music. We have DVD players in every room so people are able to watch videos for their entertainment and their comfort, much like being at home. And then one last thing is if we do have a family that needs to maybe sit with one of our providers or have a private discussion, we do have an area that we can do kind of those conferences. Pardon me. And that would be this room. So this is where our provider normally sits, but we also use this as a conference room for any type of private discussions that we may need to have about our patient care, private discussions that we have with the family about the care that we're providing. It gives us a confidential area, not to just be behind a curtain but actually a room that is private for our families and our providers and our nurses to have those difficult conversations, or any conversation that may require some privacy. So that's kind of a quick general overview of the care center and kind of the layout, as I said. Biggest highlights are the private rooms, the quietness of the floor is huge, and kind of that extension of being at home with the things that we're used to, with a TV, with adjustable heat in everybody's room. That way we can make your loved one feel as comfortable as possible.